Health Talk seeks to promote and encourage people to get information from the right sources. So here we host only specialist medical doctors. And today I am blessed, and we are blessed to have one of such, all right? Our guest speaker is a specialist psychiatrist and a medical educator with over 9 years of experience in the field. She is currently the General Secretary of Psychiatric Association of Ghana. She currently works with Ghana Health Services, where she helps the mental health department of Ghana Health Service in coordinations and supervision, training, and all that. All right, that's where she is currently. She's passionate about educating people about mental health issues. Please, she's a mother, specialist psychiatrist, poised and very passionate about what she's about to do. Please join me, welcome on board Dr. Adwoa Kusi Kyereh as she delves into the topic, maternal mental health. Dr. Kusi Kyereh, over to you.
Thank you so much, Dr. Sedo here. Please, am I audible?
Loud and clear.
Okay. So I will share my presentation now.
Yes, please go ahead.
Please, can you see my screen?
Yes, perfect. Go ahead.
Thank you so much for this opportunity. I must say that I am hoping to also learn a lot from my audience throughout this discussion. But this is a very important topic that I think as individuals, as a family, as society, even as healthcare workers, we often neglect. And I think we are in the right place discussing this. I must also say that talking about maternal mental health issues is so broad. And so today what I intend to do is just to stimulate us, give an overview of what the topic entails so that we can have a lot more discussions delving into it. And so I'm just scratching the surfaces. This is not exhaustive, but there'll be time for questions. And so I'm hoping that any other questions not captured in the presentation that someone may have can be addressed as well. So what I intend to do today, for the sake of our audience, some people may be aware of mental health in general, but I hope to use the first few minutes, 5 minutes, to talk about mental health to lay the foundation, and then I will zoom in into maternal mental health issues. Then I'll talk about the effects of maternal mental health issues on the individual, on family, on other children, and the society at large. I'll also talk about those factors that will predispose a woman to having mental health issues, those factors that will protect the woman from having mental health issues, and then I'll briefly talk about support. So to set the ball rolling, mental health, I really need to emphasize that mental health is an integral part of health. You cannot be healthy without having mental health. And so WHO has the perfect definition for health, which says that it's a complete state of well-being, physical, mental, social well-being, and not just merely the absence of disease or infirmity. And this definition recognizes mental health as an integral part of health. Without mental health, we cannot say you have health. when we talk about mental health, a lot of people have all kinds of ideas. For a lot of people, mental health conditions are just what we see in the young man, looking disheveled, dirty, walking along the street, probably stripped naked, gathered refuse around himself. That's just the picture we focus on. But I must say that mental health issues go beyond this. And I know that at the end of our presentation, we will actually know where we even come in, where we fall short, and where we fall short, not just because of a character flaw or a weakness, but just because we are human beings, just because situations happen, just because we are in this life full of ups and downs. So again, WHO has a definition. When do we say you are mentally healthy, you have good mind health? WHO looks at 4 components. You should be able to realize your ability or capabilities. You should be coping with normal stresses of life, regardless of the stress. It could be a loss, relationship loss, money loss, whatever kind of loss. It could be a difficult situation you are going through, financial situation. All these are stresses of life. Are you able to cope with these stresses? WHO also says that you should be productive and fruitful. Productivity is in several domains. What it means is that, are you able to play the role that you find yourself in? So if you are a mother, are you playing your role as a mother? If you are a worker, are you playing your role as a worker? If you go to school, are you performing well? Even in the wider social context. So whatever role you find yourself. And oftentimes it's easy when we are not functioning well. So for example, we are not able to show up at work. But then there's also what we call the presenteeism, where people show up, but they are not able to even maximize their potential, work to their full abilities. And that is still having an impairment in your productivity or your functioning. And then lastly, the last component that you need to meet for us to say you are mentally healthy is when you are making a contribution to society. So oftentimes, like I used in the initial example, just thinking about the extreme when someone has mental illness. But I must say that this is just a very small proportion of the population. A majority, an overwhelming majority of us are in the middle. We are not mentally healthy. We are not meeting this full potential. But maybe we haven't yet been diagnosed with mental illness as well. And this is where WHO calls mental ill health. So you may not have mental illness, but you may be having mental illness just because of one situation you find yourself or another. And so it brings me to this spectrum, which you need to understand as I go through my presentation on the maternal mental health. You can see that it's an arrow going in 2 directions, and it starts from a place which is colored green when we say you are mentally healthy, which I just described, when you meet all the 4 components, to when we say you actually have mental illness, that is the red. So what I was also talking about was the part in the middle, colored amber or orange. This is where a majority of us find ourselves, depending on the situation. So for the yellow, when you are facing a stressful situation and you are reacting to it, we say that you are having mental. How we felt when we reported the first COVID-19 case. We were all anxious, we were not sleeping well, people were agitated. Checking the numbers, we were having some form of mental distress. Now, when you are showing symptoms, any kind of symptoms, and it's That is the orange. Now, for us to be able to say you have mental illness, usually you meet clear diagnosis. Your symptoms, you significantly impacting on your functioning. Oftentimes, at this stage, you meet diagnosis and maybe your doctor knows you with. So setting this foundation, maternal mental health is embedded in maternal health, and it is very critical. The maternal period is the period from when the woman is pregnant through to childbirth to the postnatal period after pregnancy. And this is a very stressful and critical period for the woman and the baby. And it is extremely important that this experience is positive, because this will ensure the well-being of both the mother, the child, the family, and even the society as a whole. And I'll explain this a little further in subsequent slides. So, as I mentioned, the maternal period, we usually want to talk about the pregnancy period through childbirth to about 1 year after delivery. So there are different definitions. Some will look at just a few months, but basically we are looking at up to after 1 year of delivery. And there are so many issues that women go through during this period. And I decided to separate them into those that are just mental distress, those in the middle, what I just described, and those with mental illness. A majority of women go through the mental distress. And oftentimes we normalize it. We say, oh, it's okay. Sometimes there's a lack of support for the woman when she's going through some of this distress, which may even deteriorate to cause frank mental illness in women. So some of the situations that women go through, the mental health distress and issues that women go through include fears. So if you are in Ghana or in our parts of the world, at least you will know 1 or 2 women who have gone to give birth and never came back. And that alone is very frightening. So as a woman, you are thinking about whether this pregnancy, you would actually carry the pregnancy to term. You are thinking about the outcome of the pregnancy. Is your baby going to be fine? Is your baby going to die? Are you also going to die through this experience? And it is very frightening for women. There's a lot of thoughts that women have, which often could lead to sleepless nights. Apart from that, even the fact that you are having, especially getting to the latter part of the second trimester to the third trimester, when you are close to delivery and your womb is huge, it is extremely difficult for you to sleep. And oftentimes you are having back and waist pains and issues. So you spend several weeks on end with sleepless nights, cannot sleep on the back as has been prescribed by your healthcare provider. Sleeping on the side is difficult. You are peeing every single minute. So you basically do not rest. And I have heard a lot of women, women who are having children for the first time, telling me that they are hoping to deliver so that they can be free. And I laugh at them in my mind, because I know that even after delivery, there are more sleepless nights coming. There are lots of concerns about the future. You are wondering, remember that you have a new human being coming into the family. And this brings a lot of responsibility. You are now going to take care of a new person and that changes your life, whether you like it or not. It changes your life in terms of your time, your responsibility, and even your finances, because you have to devote so much to this new child that is coming into the world. And this is also impactful on the woman. For a lot of people, there are lots of confusion, sometimes confusion related to the body. And we all know that when you get pregnant, a way that your body tries to support the baby is to get a lot of blood flow through your body. So you have a lot of fluid all around the woman. Your body changes. And that is when you see women with a big noses and all of that, because there's a lot of fluid around the nose. You look different and you change. You begin to have skin changes, spots you didn't expect growing all over your body, stretch marks and all of that. You gain weight because of the pregnancy. And for some women, this change really impacts on them. And some women have actually complained that that's the time that their husbands cheat on them because they don't find them attractive. And then also the shame. If you were a teenager, so this is maternal, regardless of who you are, whether you were a teenager, but if, for example, you were a teenager and you got pregnant, the shame that unintended pregnancy or unwanted pregnancy brings to you is a whole lot, and that can impact on your mental health, because you have, if you came from some sub-religious groups, you are going to be thrown to the back. You won't be allowed to do certain things because your sin is obvious to everybody. And then sometimes our own cultural beliefs. So certain parts of Ghana, it is said that when you are pregnant, you don't come out. And isolation, it's actually not good for mental health promotion. But that is what some people believe, that when you come out, evil eyes will look on your pregnancy and you have a bad outcome. So early pregnancy, you do not have to come out and show the pregnancy, which impacts on people even attending antenatal clinics. There's a whole lot going around cesarean section. And some people have issues about having to go through cesarean section. In our cultural setting, it makes you less of a woman if you didn't go through the normal process. And you have some, again, sub-religious and cultural beliefs coming in, looking at cesarean section as barbaric. And so even if you have a pregnancy and you must undergo a cesarean, an absolute indication to have a cesarean section, you are so frightening. And sometimes you have some women still telling you that, no, doctor, I have to pray to change this so I can have a normal birth. So this list is not exhaustive, but there are so many issues that causes a lot of distress to women. Now, talking about the red that I talked about, when you have frank mental illness, there are so many of them. And so there are those that are common, those that are less common. The common ones are having depression and anxiety. And so in my presentation today, I will talk just a little bit about depression and anxiety. These are extremely common. You have it in so many of women going through pregnancy and the postnatal period. Also, I separated post-traumatic stress disorder, which is also quite common, and I hope to talk about that. There are those that are less common, but when it does happen, it is very apparent to everybody, and a lot of people attach a lot of stigma to it. So, for example, when you have a psychotic illness during or after pregnancy, or you have a bipolar disorder. some people also have substance use disorders during pregnancy. And this list again is not exhaustive. There's other conditions like obsessive compulsive disorders that you can also have in pregnancy. So looking at the statistics, it's suggested that it's not just suggested, but it's evidence-based, that about 1 in 5 women will have a mental health condition, illness. So when I talk about illness, I'm actually talking about those in the red, having depression and any of the anxiety issues and all that during and after pregnancy. And it could be someone having it in this period for the first time, or it's possible that the person had depression or some form of mental illness and were stable, but the pregnancy or postnatal period brought it on. Now, talking about the effects of maternal mental health issues is huge. It is huge and overwhelming. But oftentimes, because of lack of awareness, we all relegate it to the background. And so I've grouped the effects of the maternal mental health issues under those that affect the woman, those that affect functioning and motherhood, and those that affect the child. So studies have shown that if you have any mental health issue, it actually worsens your risk of having physical illness. So for example, if you had some form of physical illness, when I say physical, I mean some illness that affects your body. If you have any form of illness affecting your body with mental health issues, you are going to have a worsening of that illness that affects your body. And in fact, depression has been linked to having patients who are not seeking treatment in the healthcare services. So for example, they are not deliver and all of that with very bad outcomes. Studies have also shown that depression increases a delivery from bleeding, for example, has been linked to mental health issues like depression. And there are quite a number that have actually had bled and had these complications after pregnancy, which actually led to maternal mortality because it's going to impact on their health seeking. If you have those who are even suicidal, then they don't even seek the help and it becomes too late. It's also increases your risk of having a pregnancy if you are depressed. And then when you have any mental health issue, apart from it impacting you as a woman, it's definitely going to impact your husband. You will not be able to play your role as a wife. You won't be able to play your role as a mother. So that also impacts other children in the family. And so basically, your relationships are affected, your work is affected, and the impact is huge. Now, for the child that the woman is carrying, so studies have shown that if you have mental health issues, you are likely to have a very small baby. You are likely to deliver a preterm baby with all kinds of consequences. And then also, you are likely to have a child you won't feed well. And when you are not feeding a child well, so in our parts of the world, we have a lot of unintelligent children. So I'm putting it in this way, children with mild intellectual disability. So these are children who appear okay, but they are not smart, so they don't do well in school. They are always carrying the class, but they seem okay with other kinds of things. So they are not very good children. So we say these children have a mild intellectual disability. In our parts of the world, there are so many people like that. They end up dropping out of school at some stage, and sometimes even on the streets and all that. So there are so much consequences. There's a tendency that if there's a woman with maternal mental health issues, they are not likely to send their children for immunization. If the child is sick, they are not likely to seek care early. The impact is huge. And so these children are likely to have delayed development and growth issues. It is extremely important for very young children and babies to be attached to their mother, to be stimulated by their mother. And if you have a mother with any kind of a mental health problem, it affects their ability to stimulate these children. And so these children tend to have attachment issues, unmet emotional needs. And studies have shown that these children end up with much serious conditions, some of them behavior issues, challenging behavior issues, which when goes into adulthood, actually becomes criminal behavior. Now, what are some of the risk factors? So when we say risk factors, we are looking at some of the factors. There are certain factors that will make one woman more predisposed to having a mental health issue than another woman. And some of these factors are, for example, having a mental health disorder in the past. If you are a woman and you've gone through any kind of a traumatic situation, so some women are in a very abusive relationships, are going through intimate partner abuse and violence, they tend to have a higher risk of mental health issues during pregnancy and after childbirth. If your pregnancy was a challenging one, you went through a difficult labor, or you had complications, or you've had a previous miscarriage, then you also have a likelihood of having maternal mental health issues. If you have an infection like STDs and HIV, it increases your risk. So age, if you are young, you are a teenage mother, you tend to have a higher risk. And then also, if you're an elderly woman, an older woman having children, there is also a risk. If it is your first pregnancy, you have a risk. And if you have many children and you are coming with another child, there is also a risk. If you've gone through some form of a stressful life event, the risk is high. If you have low education as a mother, if you are poor, if you have poor nutrition, if you have very little social support from family, support from your partner or your spouse, it also increases your risk. If you didn't intend the pregnancy, so these days we try not to use unwanted pregnancy, but unintended pregnancy, then it's a risk. As for some people, they have had fertility difficulties before having the pregnancy. That also put them at risk. And there are those who have had one particular gender, so they have had all male children and are looking forward to having a female. So you have 5 boys at home, and you are hoping that this pregnancy is this child is a girl. It also puts you at risk of maternal mental health, and then also if you abuse substances. I must say that as women, our hormones play a role. So because there are changes in hormones, it actually puts us at risk of mental health issues like depression. So I must say that more women tend to have depression, premenstrual depression, perimenopausal depression, postpartum depression, just because of the hormonal changes that affects them during these periods. Now, it's not all gloomy about the maternal mental health issue, but there are factors that are protective, which we can hold on as partners or spouses, as family, as society, as a healthcare system that can help support these women going through the maternal period. So having a strong social support is protective. If you are highly educated, it's protective. If you have a good income, it's also protective. If your previous pregnancies were positive, so your birthing was positive, it's also protective. And having high quality maternal and child health services. This is really important because a lot of people complain about attitudes of healthcare staff, how they treat them, procedures they carry on them without acknowledging their concerns, how they talk to them. Some women are beaten during the birthing process and all of that. So I know my time is fast spent, but I'll briefly go through some of the common ones. We have what we call the baby blues or the postpartum blues, and this affects a majority of women. Basically, you are having a lot of symptoms that looks like you are depressed, but it really goes away in a very short time and usually will not go beyond 2 weeks. And majority of women actually go through this. So some of the symptoms, these women are crying a lot, they feel tired, they are having sleeping issues, they cannot think well, they are nervous around the baby, they get easily irritated and annoyed, and they don't know why. And you have that feeling that nothing can be the same or not feeling like yourself. It comes few days after pregnancy, but often by 2 weeks, you are fine. However, if you have these symptoms persisting beyond 2 weeks, then you probably are having depression, postpartum depression. And so with postpartum depression, you need to have had these symptoms persisting and ongoing for 2 weeks. It's also common to have associated anxiety symptoms and sometimes symptoms that have to do with your body, like having pains here and there, headaches, and all of that. And this could actually be depression. So another thing that differentiates the postpartum depression from the postpartum blues, the postpartum blues are milder, so you are not going to have any thoughts of feelings of hopelessness or worthlessness and think about taking your own life or harming your baby. Once that comes in, it is no longer a mild baby blue. And then we also have anxiety, which is very common. It actually affects about 1 in 10 women. But studies have shown that in our parts of the world, it is much more. If you go to places like the northern parts of our country, studies that have been done have actually shown as high as almost 50% of women having these mental health issues. So with the symptoms, you are feeling anxious, you cannot control yourself, you are worrying excessively, you are finding it difficult to relax, you are also irritable and agitated, you cannot concentrate, and then you have difficulty sleeping. So these are some of the symptoms. But then you can also have physical symptoms like feeling your heart beating fast and loud, you feeling dizzy, feeling like you want to faint, you cannot breathe well, sweating, or feeling a lot of tension and even numbness in your body. So all these could be signs of anxiety. Now, briefly to talk about perinatal post-traumatic stress disorder. This is an important and serious condition that usually occurs around childbirth, usually during the labor period. And it happens in the context of a traumatic birth. So if the birthing experience was traumatic to the woman, and the woman felt very unsupported or disrespected, depersonalized, maybe pushed, beaten, and their feelings were not acknowledged, they have a risk of having traumatic stress disorder. And it's actually common. So you hear some women who do not even want to go through the birthing process again because they are having the post-traumatic stress disorder. So usually what happens is that traumatic bad experience you had during the birthing period, during the day, it's like you are having flashbacks of this experience. At night, all your dreams are centered around that experience. Avoid anything that reminds you of that. And then it can affect you in different ways. When you find yourself in situations that remind, basically you are reacting, how your feelings change, how you relate to people and places change. And some of the risk factors for the post-traumatic stress disorder, like I mentioned, if you had a negative experience. But some people, for women who are having their first pregnancy, it may not be the experience, but it may be the perception. You've heard stories, other people, what they went through and all of that. That can put you at risk of peripartum post-traumatic stress disorder. And then if your delivery mode, there was an emergency cesarean section, it also puts you at risk. If you have a low social support from staff, family, and your partner, it also puts you at risk. I decided to bring this because, interestingly, if you have PTSD, it increases your risk of a preterm birth, having a low birth weight in infants, having gestational diabetes, subsequent pregnancies, preeclampsia, and depression. So there's also a strong link with maternal mental health issues with other obstetric complications. Now, this is the last part. I have talked so much, but of course, what I want to say is that when it comes to supporting women with maternal mental health issues, help is available. And I really want to stress on the help. Help is available. Oftentimes, during this period, there's a lot of support that is given without medication. We only give medication in the specialized setting when it is needed. We tend to do a lot more of other things than even medication. So help is available, but oftentimes mental health issues are stigmatized in our setting that affect the health seeking of people. So people may not even want to seek help, even though they know that they find themselves in such situation. Now, when it comes to supporting women, it's important that we need women, these women need to take care of their own self, but they also need a lot of support from their partner and spouses, from the family, from the healthcare system. And I must say that to be able to support women who find themselves with mental health problems and illness, we need to come together as a whole to be able to support these women. Of course, there are other situations we need to the consider that cannot be captured here, I'm sure may come up in the questions. Support for partners. So some studies have shown that about 10% of men also have depression in the postpartum period. So they also suffer. They suffer silently, and oftentimes we don't talk about them. There's also another group we don't talk about: those women who miscarry and lose their babies during pregnancy, and it's a very difficult situation for them. And oftentimes we just assume that, oh, you are a woman, you have your womb, you can give birth again, so it's okay. But studies have shown that this is a serious risk factor for mental health issues like depression. So I will end here and make time for some questions.
Thank you very much, Dr. Adra. Thank you very much for great presentation, very detailed and very easy to understand. And I'm sure lots of people can relate. Now it's opportunity for all of us on the call, on YouTube and on Zoom to ask your questions. Very simply done. Just drop your question in the chat box in a comment section, and Dr. Kusichire will gladly answer your questions. Please drop your questions in the chat box in the comment section, and it will be answered. We assure you of that. Like I said earlier, this is free specialist medical consultation. Comes at no fee. You just need to have a good internet. That's all right. So this is the Weekend Health Talk, and I am Dr. Albesedo here. I'm glad that Dr. Adra Kusichire took time. Yes, she took a little more, but it was needful. All right. And I'm happy she also acknowledged the 10% of men who also have some postpartum issues as well. Thank you very much. Very, very great presentation. And I'm sure most of us have been well educated, including those of us on the field as well. Thank you very much, Dr. Kusichire. Now it's time for questions and answers. Please feel free, drop the questions in the chat box, in the comment section, and answers will be provided. Thank you very much. I am looking through to see. All right, somebody's asking for the slides. Okay, so I will, if you can hit me up on WhatsApp, Jacob, if you can hit me up on WhatsApp, I'll ask Adjoa if she's willing. I will share it with you. So just hit me up on WhatsApp. If she's willing, I will share it with you. All right, any other questions? Any other questions? Any other question? Please feel free and ask your questions so you get free answers. All right, thank you very much. We all agree it was a wonderful presentation, very detailed. For those of us who joined us late, there will be the recording provided, especially from the very beginning when she was talking about the mental health distress. Some of them may not necessarily have progressed to the mental illness stage yet, but the distress stage, most people missed that. So the recording will be made available. All right, Jacob is asking. All right, so I will send it to you, Jacob. I will send it to you. I will send my WhatsApp contact to you. Any questions, please feel free and drop it in the chat box. Any question, please feel free and drop it in the chat box. All right. Yes, another person is also asking about the slides. If she is willing, I will share it with you. So I'll ask permission from her. And if she's willing, I will share it with you on WhatsApp. All right. Any questions? Any more 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 questions? It was so well explained. I'm sure most of us understood a lot of things. Thank you. Everybody just appreciating Dr. Adra for, okay, what role does diet and physical activity have on mental health? So, Doc,
Yes.
first question.
Yes.
What role does diet and physical activity have on mental health? That's your first question, please.
A big role. A big role. In fact, I cannot overemphasize the role of healthy eating on promoting your mental health and physical activity. So studies have shown that when you eat So healthy diets that are rich in so fruits, vegetables, legumes, whole grain cereal, omega-3 fatty acids, which we get from fish oil, are extremely important. These are building blocks for the brain cells. And so you can actually eat healthy diet and promote your mental well-being. If you're under stress, eating well can actually reduce your stress levels. Same for physical activity. So our brains function with the work of our brain cells. And studies have shown that with physical activity, you build connections in the part of the brain which is in front of your brain, which helps you with all the wonderful thinking, your ideas, your creativity, your memory, what we call your working memory. It also helps you with even controlling your emotions, which are all functions of the front part of your brain. And this part of your brain, studies have shown that when you are doing less of physical activity and all that, it shrinks. So physical activity, healthy eating and diet, it is so important for promoting your mental health. It's actually so sometimes when we have deadlines to meet and you have the option of engaging in a physical activity, I mean, it is the choice that most of us will make will be to finish the deadline because you don't have enough time. But in fact, if you go and have that physical activity or you exercise, it improves your efficiency and effectiveness on whichever work that you are working on because your concentration improves, your memory, everything. So physical activity diet cannot be overemphasized. It's so important for promoting mental health.
All right, so the next question is, during pregnancy, some women don't want to see their partners. Is there any reason?
So I may need to probe further to find out why those particular women do not want to see their partners, and what exactly is they don't want to see their partners. Is it that they are irritable and all of that? So I will need further information to be able to answer this question.
All right, thank you very much. Somebody's also asking, what fruits will you advise a woman in the first trimester to use, to take? What fruit will you advise?
Oh, so I would say that there isn't a particular fruit, and the first trimester is also a very tricky period. That is when you don't have appetite for certain food. So there really isn't a particular fruit that I will recommend. Recognizing the challenges that women go through in the first trimester, what I will say is that in year and all of that, just make sure that you are having a balanced diet. So whatever you are eating or whatever you have appetite to eat is balanced. But there is no particular recommendation for that. It will depend on everybody what.
Hello, Doc.
Hello, please, am I audible?
Yes, you are back now. We lost you for 3 seconds.
Hello, please, can you hear me?
Now we can hear you. We lost you for some few seconds. Now you are back.
Okay, yes. But did you hear my response on the recommendation on fruits?
Yes.
Okay. Thank
Yeah.
you.
All right. Any more questions, please drop in the chat box in the comment section, and Dr. Kusichira will gladly answer all the questions for you. And for those of you who missed the initial stage or who joined us late, please have dropped the YouTube link in the comment section on Zoom. Feel free to subscribe and put on the notifications so that once I upload the recording, you have access to it and also be able to share with others as well. This is good information that a lot more people need to have access to, and it is free. Thank you very much. Thank you very much. Now, there's a very important question. Dr. Adjoa, please be on standby. Please, some said pineapple is not good for first trimester pregnancy. How true or false is it?
So yes, I would want to ask a follow-up question on why pineapple is not good for first trimester pregnancy. Is it that it induces vomiting? What are the reasons?
Okay, so Christine, you can elaborate on what you've heard it causes. So Christine, you can elaborate on what you've heard. These are some of the hearsays, all right? So she will answer you, but she wants to know what you've heard it causes, all right? While she's getting us the reason what she's heard, someone is also asking if you can throw more light on the perinatal PTSD and prematurity and low birth weight.
So to throw more light on the perinatal PTSD, I believe that's where the question is coming from. Yes.
Yes.
So
the link between
perinatal
that and low birth weights, prematurity.
Yes. So it's been found that if someone had perinatal PTSD in their previous pregnancy, they have a high risk of having low birth weight and prematurity in their subsequent pregnancy. And
Good.
and there's also evidence to actually show that if you are having depression and other mental health issues during the pregnancy, it directly actually impacts on the baby. You have a high likelihood of having intrauterine growth restriction baby, low birth weight, and prematurity as well. So there are so many different links.
All right. Thank you very much. Now, Christine is saying that what she's heard is it's been said that if you take pineapple in the first trimester, you might end up losing the baby. That's miscarriage.
Okay, right. Thank you so much, Christy. So I haven't heard that from any evidence so far. But since you brought it up, I think it would be good to check it up myself. But throughout medical school, throughout my training, I haven't come across an evidence base with that one. And I must say that there are a lot of information online these days because of our generation. There's so much information, but you really would have to check the authority and the source of information. So, for example, if you are receiving information from CDC, WHO, Ghana Health Service, Mental Health Authority, you know that this information carries authority. So it's easier to believe it. So it's evidence-based. Otherwise, you have to be careful. But I would check. But I currently am not aware of pineapple being absolutely contraindicated in the first trimester.
Thank you very much, Dr. Adjoa Kusichira. The truth of the matter is it is not contraindicated. It's a myth that is propagated through hearsay. This one says, avoid this, don't do this. You know, early pregnancy is so special. There are a lot of changes going on. So lots of people have lots of hearsays, and these are tales from grandmothers that's passed to mothers and passed to daughters, and it keeps going on. So yes, I've also heard people say that, but there is no scientific basis. As Adjoa rightly said, in our training, there's no evidence to show that if you eat pineapple in the first trimester, you are likely to abort the baby. It is not based on science. That is why the Weekend Health Talk is an avenue where you hear from the expert, not from people who are not qualified to be educating you on health issues. Thank you very much. Anyone else have it? Okay, somebody asking, what support system are there for women going through mental health challenges?
Please, is the person asking support system in the healthcare system? Is that where the question? What kind of supports for women through the healthcare system?
What resources do you recommend? That's what Daniel is asking. What support systems are available, and what resources do you recommend?
Okay, so what I would say is that during pregnancy, so we say that information is power. So we were just talking about also getting the right information. Sometimes limited information, a lack of information can actually get you to be anxious, to wonder about so many things, some of which you shouldn't worry about. And so I would say that I know there are pregnancy schools in the Ghana Health Service, the teaching hospitals, and other facilities. There are pregnancy schools that they try to give information to the pregnant woman on what to expect, when they should seek help, and what to do, what not to do, and all that. So first, I will recommend that if you have any questions, please check with your healthcare provider. And so that is one resource that I will recommend. The other, in terms of support, I must say that Ghana Health Service is coming up with maternal mental health program, which is going to be comprehensive to support our pregnant women and women in the postpartum period. It's been started, but it's still going through. We are done with the countrywide situational analysis. So we know where our deficiencies are, and that is what we are using to develop the program. So you'll be receiving a lot more support from the health facilities going forward as well.
Thank you very much. So Daniel, what advice Dr. Kusitre is saying is that it's always advisable for every pregnant woman to start antenatal clinic, and there's pregnancy school for everyone, and everything that they need is taught there as well. So that's one of the, and of course, there's an incoming comprehensive document from the Ghana Health Service, which is privy to, that will help give more resources to pregnant women as well. Yes. Any more questions? Please drop it in the chat box. Drop it in the chat box. Any more questions? Please drop in the chat box. Dr. Adra Kusitre is a specialist psychiatrist with Ghana Health Service into mental health education, supporting and coordinating events with Ghana Health Service. And she is also the General Secretary of Psychiatric Association of Ghana. She is our guest speaker today. We are honored to have her. She gave us a comprehensive overview of maternal mental health issues, and a lot of people are impressed, and a lot of people are asking about the slides. Doc, I'll be very grateful if after the presentation you can squeeze the slide into my DM so that I can share with people who are interested. Thank you very much. Any more questions? Please drop it in the chat box. Drop in the chat box. Drop in the chat box. Any more questions? Please drop in the chat box. Any more questions? So that Dr. Adra Kusitre can gladly answer you. All right, so we'll talk about that. Theophilus, we'll talk about that offline, all right? We'll contact her and ask her availability, yes, we'll ask her for her availability. Any more questions? Any more questions? Any more questions so that Dr. Adra can... All right, Doc, at this point, since there are no questions coming in quickly, I would want you to give us your final words with respect to maternal mental health awareness. What will be your final words to all of us? There are not many questions because you explain everything explicitly well to the understanding of the many of us who joined, or close to 100 people. Please, and I would also encourage all of us to subscribe to the YouTube channel, Dr. Albesedo here. When I drop the recording, you can listen again for your own education and help us share it. That's how you're going to help us. Help us share the link so many more people get to know the truth. This pineapple issue, some people are saying, don't eat too much, don't do this. You see, get to hear from the expert. Of course, too much of everything is bad. All right. So get to hear from the experts. So this is free knowledge, and we are all our mother's children. All of us here, we are our mother's children. So we want the health of our mother, the pregnant women during delivery and then childbirth. So all of that. So when we drop the recording, just share it to as many of your friends as much as possible so that they get well educated. Doc, please give us your final words.
Thank you so much for this opportunity. What I would want to say is that it is okay as a woman to have mental health issues during your pregnancy period or your postpartum period. It is okay. And so do not feel afraid or shy to seek help, especially when you find that whatever situation you are going through, persistent. If you find that whatever you are going through is severe, it's impacting on your role, child, even to take care of your family. If you find that your safety is at risk, then you've been thinking of harming yourself or harming the baby or even another person. If you find is going on, please seek help. Help is available. Thank you.
All right, thank you very much. Dr. Adra says there's nothing wrong with having challenges. If you find yourself having any challenges, just seek help. Seek help. And in the regard of and in the wake of seeking help, there is a hotline from Mental Health Authority, and I'm dropping that in the chat box. I will drop it on YouTube as well. It's 0800 678 678. If you need help, it's also the suicide hotline for Mental Health Authority. You're seeking help, you will get 0800 678 678. I'm dropping that on both Zoom and on the YouTube as well. So anyone who needs help, any form of help, you need some clarifications, please, when you you call this number, you will be provided with the necessary help. All right. So because we know some mental health issues are quite private, confidentiality and privacy are required, feel free. You will speak to a professional. 0800. The number is so easy to remember. 678 678. The prefix is 0800. All right. 0800 678 678. All right. The aim is to reach as many people as possible. So once again, in the chat box, I'm dropping the YouTube link. Subscribe, put the notifications button on, share the link, have your friends also go to watch the recording. Once again, on behalf of myself and everyone else, please want to say a special thank you to Dr. Adjoa Kusitre for a wonderful and a comprehensive presentation on the topic under consideration. We've all learned a lot and all questions were answered. We appreciate you so much, colleagues and everyone else. Thank you very much. If after listening to the recording, you have any questions, you can drop it in the YouTube comment section and it will be attended to. Next week and beyond, we'll be coming your way once again with lots more interesting topics. Next week, we're going to be talking about early adulthood mental health awareness. We are going to talk about childhood mental illnesses, ADHD, autism, dyslexia, and all those ones that you know of, that you might have heard of, that you don't have adequate knowledge of. So don't miss it. It's still going to be 4 p.m. next week, Saturday, God willing. Until